Hello, thank you for joining us today. My name is Elizabeth Nix. I am the chief nurse for the City of Houston Health Department for the Office of Chronic Disease, especially our DOM department. Our DOM department is basically the Diabetes Awareness and Wellness Network, where we talk about and treat diabetes, how to prevent diabetes, and other chronic diseases. So today we're going to talk about the top 10 risk factors related to diabetes or that can contribute to diabetes. And then we're going to talk about some of the tricks and tips to avoid diabetes, okay, or manage your diabetes, either way. Number one, being overweight or obese. Being overweight and obese can be a very leading contributing factor to developing diabetes. Basically, it's just your body is having too much fat, adipose tissue, and is not allowing your body to um, metabolize the insulin the way that it's supposed to. That is one of the major contributing risk factors to diabetes. Number two is lack of physical activity. You have to be very active. You cannot be inactive. You better want to manage your weight a little bit better with being a little bit more active. Sedentary lifestyle doesn't allow your blood sugar to be used properly in your body. So it is very important to be active. So you can't be just like, oh, I just don't feel like doing too much workout too many times, too often. Okay. Number three, being or having unhealthy eating patterns. Unhealthy eating patterns would be like diets high in processed foods, sugary drinks, um, things that doesn't have any nutrients to your body, refined sugars, things like that. Those are going to be things that's going to be like an unhealthy eating pattern. Also, inconsistency with the timing of your eating, skipping meals also will play, a big factor in your blood sugars elevation or decreasing. Family history. If you have a family history of someone with diabetes, that can contribute to developing diabetes as well. Um, you like your brother, your sister, your mother, someone who is very close knit with your family. Um, and it also has a lot of genetics um, links to it as well with your lifestyle changes. Also, a lot of things we develop based on how we were raised, not so much just genetics, but we pick up a lot of family traits as well. Some of those are good and some of those are not so great. Number five would be our age. As we increase in our age, we increase with the risk of developing type 2 diabetes. Um, Sometimes it's related to your hormones, sometimes it's related to sedentary lifestyle changes. Sometimes we're not cooking or not as active as we were prior to. So as we age, when we get about 45 on up, that's when your risk factors really increases to developing type 2 diabetes. Number six, race and ethnicity plays a big part in developing diabetes. People with the highest risk would be our Hispanic population, our African American population. Those are the highest risk factors. A lot of it is contributed to our economic. Um, when you don't have the money or you're not in a stable work environment where you just have a lot of access to resources, that is one of that's going to lead you to eating a little bit unhealthy or having a sedentary lifestyle, even overworking. also plays a big role in that as well because of a certain race and ethnicity. You don't have regular work hours. Number seven, history of gestational diabetes. If you are a woman who were been pregnant and you were diagnosed with gestational diabetes while you were pregnant, you have a higher risk of developing type 2 diabetes after your pregnancy, especially if it's more than one pregnancy. The higher the pregnancy number, the higher your risk factor is to developing type 2 diabetes. Number eight, high blood pressure, abnormal high cholesterol. That is another risk factor as well. If you have multiple chronic diseases, those are kind of linked together. Usually, if one is uncontrolled, something else is uncontrolled, then your body is trying to regulate itself, but it also has a way of playing with your insulin resistance. So make sure that if you have hypertension or high cholesterol, that you try to get it all managed at one time. And most of the time you can with your diet and exercise moderations. Number nine, if you are a woman who has PCOS, you are also a higher risk for developing diabetes as well. Again, when we're talking about hormonal changes, these play a big role because it causes insulin resistance as well. Number 10, if you're a diabetic, I'm sorry, if you are pre-diabetic, that is a leading risk factor to developing diabetes later on. And what we're trying to do is making sure that pre-diabetes does not go into lead into diabetes as well. So um, you might want to make sure that you keep a close eye on being a pre-diabetic and monitoring your A1C and exercise to decrease developing type 2 diabetes. And some of the tips for preventing diabetes would be maintaining your weight, eating a healthy, balanced meal, whole foods, things like that, staying active, getting regular health screening. Don't avoid the scale because the scale is going to be something that you don't want to avoid because it kind of keeps you in check. Getting enough sleep and monitoring your stress levels or managing your stress levels as much as you possibly can. Avoid smoking and limiting of alcohol. I should also say drugs as well too, because hey, it all influences our behaviors, right? Um, Staying hydrated and making sure that you keep your regular routines. Those are some of the risk factors that can possibly help decrease the chances of developing type 2 diabetes. I hope these tips help, and I hope giving you the number 10 factors to reduce your diabetes is also going to be helpful for you. Thank you for joining us. My name is Elizabeth, and with the City of Houston Health Department.